and welcome to a thought provoking episode of our podcast. Our topic for today's discussion is weight management in metabolic disorders. It's a subject of immense importance, especially given the global prevalence of obesity, which affects over 1 billion people. This condition often goes hand in hand with various metabolic disorders, including type 2 diabetes, non alcoholic fatty liver disease, cardiovascular condition, chronic kidney disease, and various forms of cancer. As we navigate this complex landscape, we'll explore a range of questions from the importance of weight management to practical lifestyle modifications and dietary plans for individuals with metabolic disorders. We'll also delve into real world cases discussing strategies and success in managing both weight and concurrent health issues. Additionally, we'll touch on the exciting advancements and emerging therapies in the field of weight management for metabolic disorders that hold great promise for improving patient care. And we are privileged to have distinguished diabetologist joining us today, Dr. Surajeet Kumar Patra. Dr. Surajeet brings a wealth of expertise to our discussion with an impressive 18 years track record of providing exceptional clinical care. In recognition of his outstanding contributions to the field, Dr. Surajeet has received 3 prestigious accolades in 2022. That is the most innovative and iconic diabetologist of the year, Diabetes India Award, and the Seva Ratna Award for his outstanding service in the state of Odisha. So let's embark on this journey together and discover insights that we can make a profound difference in managing metabolic disorders through weight management. Dr. Surajeet, it's a pleasure to have you here with us today.
Thank you, Dr. Arsita. Thank you, and we will discuss about this important topic, which is related to the weight management and lot of the different branches, or I can say the outgrowth of this obesity. We'll discuss in detail, and public awareness is absolutely essential.
Yes.
Education about the causes and lifestyle management is absolutely essential to take care of this pandemic. We can say obesity is a pandemic at present, and it's an emergency. We can discuss about this. So
Yes,
thank
doctor.
you, Dr. Arsita.
Yes, doctor, thank you. So let's begin our conversation by establishing a fundamental understanding of why weight management is essential. So,
Absolutely.
doctor, can you tell why we need to manage weight?
Absolutely. So let me tell you in one line, weight or overweight or obesity is the fertile soil where more than 100 different diseases grow. So let me decode this statement. Okay. Obesity or overweight, or like in simple language for general public, like increase in fat content in our body or in different organs. Okay. So what happens once we have increased number or increased cells or increase in fat content in our liver, pancreas, heart, blood vessels, all these organs. So why we require or why we need to know about this? Because if you do not take care of this obesity or overweight, this can lead to more than 100 diseases, different diseases, and all those diseases, they have their root causes on this obesity or overweight. So to take care of those 100 disease or the ultimate goal, so why we should know? We should know because our ultimate goal is to prevent the complications of all these metabolic diseases, or prevent the complications of obesity. So to prevent the complications of obesity, we must know the different aspects of obesity and how to take care of that. So why we need to know? The answer is to prevent the complications of obesity. Okay. So that is how we need to have public awareness on this part. And that statement I would like to re-emphasize: obesity or overweight is a fertile soil where more than 100 different diseases grow. Okay.
Yes, doctor, rightly said. And then, what are the primary lifestyle modifications you recommend for individuals with metabolic disorders who are looking to manage their weight effectively?
Absolutely. So the most important word I usually discuss with our people with obesity. We usually call people with obesity or obesity person with obesity. The most important thing, lifestyle management. But before that, I would like to emphasize on one word, and that is individualization. Obesity management or weight management is absolutely individualized. It is not like I have a general protocol. If you follow this protocol, everyone with obesity will reduce their weight. No, it is not like that, because our body metabolism is different. Every person have different body metabolisms. Okay, so the management strategy is also need to be individualized. So that's what my term or my point of emphasis is individualization. So on a case to case basis, for example, a person with type 2 diabetes or obesity, he has different body metabolism. A other person with obesity and maybe obstructive sleep apnea or some other conditions, he has different metabolism. So there cannot be single protocol taking care of all the obesity, overweight, not like that. So it is individualization. So based on individualized metabolic parameter, anthropometric parameter, we need to devise, or we usually devise in our clinic. So what are the correct lifestyle management factors that is suiting for your case? Okay, and that is individualized. Related to the lifestyle management factor, which you asked very rightly, lifestyle management is first line therapy. Okay, lifestyle management is first line therapy for overweight, obesity, and any other metabolic diseases. So what do we understand by lifestyle management? So this is a this term lifestyle management is very loosely used by people and in different conditions, different situations. Let me decode this word LSM or lifestyle management. This is like, we did one questionnaire survey in our clinic with the people, the relatives who are coming with the patients. Okay, so what do you understand by lifestyle management? Just simple, this is the question. So they say that diet and exercise, diet and exercise. So this is the most common myth or most common belief among the people, that lifestyle management means diet and exercise. It is not like that. It is not like that. Let me tell you, the lifestyle management is consisting of four major factors. Okay, out of the four major factors, number one, diet, exercise, stress management, sleep hygiene. These are the four major factors. Okay, diet, within the diet, it is not like that I am taking less carbohydrate or zero carbohydrate, I am doing this, and that is not the diet. So again, individualization, individualized diet management. So for example, a person with BMI of 27 with type 2 diabetes, and depending on the various metabolic parameter, laboratory parameter, and anthropometric parameter, we came to know that okay, we decided that okay, 1600 kilocalorie is optimum for this person. Okay, now that 1600 kilocalorie, that should be balanced. Out of that 1600 kilocalorie, 30 to 40% will be carbohydrate, 20 to 30% protein, 10-20% fat, and then at different timings. So diet that again consisting of different timings, we can say 3x2 pattern, 3 major meals, 2 snacks, and how the 1600 kilocalorie is distributed at different time periods. That is the whole beauty of this diet management. Okay, that requires a team of dietitian, diabetologist, diabetic educator, and the patients, everyone. So that is part, that is diet. Exercise, now it's the era of technology. Okay, like we can say number of steps, we have step counter or smartwatch we can have, or step counter we can download freely from our app store or play store. Every day, like 7k to 8k, again individualization. But for example, a common type 2 diabetes with overweight case, for example, we decided that this person's require 7k to 8k steps per day. Okay, now we guide the patient and we guide them. We did the education part, diabetic education, overweight, obesity education. That consistency is important. It is not like that you are motivated now with the doctor, within the doctor clinic, and then once you go for next 7 days you continue this, and then usually what happens, that motivation fades and they usually come back to their previous routine. Not like that. You should maintain the consistency, 7k to 8k steps per day, any time of the day you can walk. Okay, so diet, then exercise. Brisk walking is the king of exercise. That is the most important point I usually say. You can do all the fancy things. People are saying young masses are coming, age 25-30, I am going to gym, sir, I am doing my bicep, I am doing this this thing, that thing. Okay, everything, all those things are fine. If you are happy with that, if it is suiting your lifestyle or your routine, that is fine. But brisk walking is the king of exercise. You do 7k or 8k steps, you can increase up to 10k steps depending on your anthropometric and metabolic parameters. So diet, exercise, then stress management. Stress is part of our life, cannot be zero. We all have stress in our life. There cannot be a situation where zero stress, but stress management, and again individualization. Stress management, there are different techniques of stress management. Listening to music, pranayam, yoga, all these are stress management techniques, but it cannot be generalized. Whichever is suiting to you or the individual, he should continue that. And consistency, it should be a continued process. Okay, so diet, exercise, stress management, then sleep hygiene. Sleep hygiene means sleep quality and sleep quantity. Sleep quality or sleep quantity means 6 to 8 hours or 7 hours of sleep. Sleep quality means undisturbed sleep. Okay, so these are the four major factors, and consistency is essential. Individualization, lifestyle management, consistency, these are the three important terms. If you manage this, then obviously your lifestyle management will be better and you will see the result: weight reduction, increase or improvement in your metabolic parameters, lab parameters. You will see all this in the result section. Okay, so this is in a nutshell about the lifestyle management part.
Yes, doctor, very rightly said. Consistency is very, very important. People do for some days and then leave it. So, yeah. And, doctor, now are there any specific dietary plans or nutritional guidelines you find particularly effective in weight management for individuals with metabolic disorders?
Yes, right. So again, individualization, but 3 4 important points I would like to emphasize here. Diet. So there are different diets like previously. DAS diet, Mediterranean diet. So Mediterranean diet is essential, important. The balanced diet is required, and there are different guidelines also by different societies, like RSSDI guideline, ADA guideline, endocrine society guideline. So different guidelines are there. All those are fine, but individualized. And now it's an era of CGMS. Okay, so I usually call it CGMS diet. So what is CGMS diet? CGMS is continuous glucose monitoring system. Okay, if you put that sensor in your tricep, it will give you an graph 24-hour your blood sugar levels. Okay, so that is interstitial blood glucose level, interstitial fluid blood glucose level, but that is continuous glucose monitoring system. It is giving you a value of your blood sugar levels continuously for 24 hours, and it will last for 14 days. Okay, now the diet, individualized, whichever diet is suiting your metabolism, your body, and keeping your time in range. So TIR, time in range, in CGMS there's this parameter, time in range, in 24 hour, 70 to 180, 70 to 180. Within this range, what amount of time in 24 hour is your blood glucose level within this range, 70 to 180. So if in 24 hour every time your blood glucose level is between 70 to 180, then that means your time in range is 100%. Okay, so optimum, what is optimum thing? Time in range, it should be more than 70%. Then time below range and time above range. Time below range, like below 70 milligram per deciliter, hypoglycemia should not be. Ideally time below range should be 0. Okay, time above range should be 0. That's why time in range should be 100%. Okay, now whatever amount of food you are taking, and you can directly see after 2 hours or within that 2 hours, the graph it will show. So CGMS diet means whatever diet you are taking, if those diets are taking care of your blood sugar level, time in range 100%, and glycemic variability. Second parameter is glycemic variability. There should not be fluctuations in your blood glucose level, okay, because of your food intake. So if your glycemic variability and time in range is optimum based on the CGMS, then your dietary part is fine. Okay, so this is called CGMS diet. Why CGMS diet? Because every individual, the response of our body or response of our metabolic system to food is different for different people. So that's why individualism. In the era of CGMS or in the era of technology, we should utilize the technology. Okay, and know, like, if I take 1 katori of rice, how much blood sugar is increased. If I am taking 2 katori of rice, how much blood sugar is increased. That can be known nowadays with the help of CGMS. And the same thing, like 2 katoris of rice, my blood sugar is increased up to 170, for example. Before taking food, it is, for example, 110. After taking 2 katoris of rice, it is increasing up to 170. So that is fine. Still, it is below 180. Okay. But another person, he or she may have one cutlery of rice and it may reach up to 170 or 180. That's what individualization. Every person, based on their own food habit, based on their own metabolism, they should know. And this CGMS is there for 14 days. So within 14 days, if you try different food habits or food intake, based on your own metabolism, based on your own food intake, what is the level of blood sugar levels. And that's how you will know the metabolic activities within the body and what is the time in range, what is the glycemic variability. So this is one part. This is CGMS diet. Whatever diet you are taking, combine that with CGMS, take care of your sugar levels, time in range, and glycemic variability. This is the most advanced situation at present. Okay. For example, let's say if we do not have CGMS, then what to do in that situation? In that situation, balanced diet. Balanced diet is optimum. Your carbohydrate, okay. So in India, we know like India is a country of high carbohydrate consumption. We are like 60, 70, 80% and in diet study, there's that study, in diet study, we know that 60, 70, 80% carbohydrate consuming. So that's what we need to take care of, that carbohydrate. It should be like 30 to 40% or up to 50% is fine, but more than that, it will definitely impact our metabolism and impact our blood sugar levels, and that will lead to other like fat content, triglyceride increase, all those things. Okay. So balanced diet is absolutely essential. Within the balanced diet, different portions. So carbohydrate, it should be there. That should not be zero carbohydrate. That is another entity. They have some detrimental things, negative effect or side effects also. That should be balanced diet. Okay. 30 to 40 or up to 50% carbohydrate, 30 to 40% protein, and 10 to 20% fat. And within that fat content, MUFA and PUFA. Those two things should be optimum. Protein, in India, we have different studies, and in our clinic also, we saw that protein intake is little bit on the lower side in Indian context. So 1 gram, so as per the recommendation, 1 gram per kg per day, that is the optimum or ideal intake of protein. We should take that, but in India, it is lesser than that. So protein intake needs to be optimum or needs to be increased, and that included in our diabetic education or diet education. So taking care of this balanced diet. Now, for example, a person is already overweight or obesity is there, then what to do in this situation? So there is popular thing called minus 500 diet. So minus 500 means at present, based on dietary recall, you can get a dietary recall in last 2 days or 7 days. Usually what happens, which we understand, which we think that it is normal, it is close to 2500 kilocalorie or maybe 2000 kilocalorie. Whatever you are taking, just minus 500, reduce 500 kilocalorie. How to reduce? Reduce from all carbohydrate, protein, fat, or mainly reduce from the carbohydrate part. Okay. So 500, for example, someone is taking 2000 kilocalorie daily, and this is his lifestyle since last 3 years, 5 years, 10 years. Just reduce 500 kilocalorie minimum for next 2 months, and you will see the result. There will be improvement in your glycemic parameter, improvement in your lipid parameter, improvement in your weight reduction. So all these are the individualized dietary management plans. So we usually discuss with the patient, and depending on their own individualized lifestyle, we usually do the minor tweaking in the lifestyle and included all these things, so that the patient will be aware of the different facts related to diabetes or related to the diet, and then accordingly, after maybe 3 months, 6 months, we will decide about the weight reduction part, and we will see what is the weight benefit the patient is getting.
Yeah, thank you, Dr. Surajeet, for your comprehensive explanation. And now, how do you approach the management of weight in patients with metabolic disorders?
Okay. So, for example, this overweight or obesity plus metabolic disorder. In this situation, we need to have like two-pronged approach. Okay. One side, we need to take care of the HbA1c. This is called ABC. Okay. A is HbA1c, B is blood pressure, and C is cholesterol. These are the metabolic parameters, and this is included in the metabolic syndrome also. So, one side, we need to take care of ABC. Our goal is HbA1c less than 6.5, B blood pressure less than 130/80, C cholesterol, LDL, bad cholesterol should be less than 70, and triglyceride should be less than 150. These are the goals. From the beginning, we need to explain to the patient that these are the goals. Currently, we are here. We need to reach in this goal. How to reach the goal? Lifestyle management plus medicine, plus medication adherence. Okay, this is one part. Parallelly, we need to take care of the weight or overweight or obesity part. Okay, so that's where lifestyle management is the most important thing in both the situations, like obesity plus metabolic disease. In both the situation, lifestyle management is first line therapy. But if there is obesity or overweight, you can try for 3 months or 6 months only with lifestyle management to reduce minimum 5 kg in 3 months. It's a very small target. Okay, if only with lifestyle management, if you can reduce 5 kg in 3 months, that is very nice. You can try another 3 months, 6 month 10 kg weight reduction. That will be optimum, and that will give a positive or beneficial effect on the metabolic parameters also, ABC parameters also. Okay, now after 3 months or after 6 months also, if weight reduction is not optimum or not up to the mark as we expect, like minimum 5 kg in 3 months or 10 kg in 6 months, then lifestyle management plus medication. So there are certain medications which help in weight reduction. They are also having beneficial effect on the blood sugar level, or these are the medications for diabetes. Okay, and they have extra advantage of weight reduction. So there are different medications, but all these medications must be done under the guidance of diabetologist or endocrinologist or your physician doctor. Okay, so metabolic parameters, lifestyle management plus medication adherence for obesity and overweight, lifestyle management for initial 3 months 6 months, and then if you are not getting optimum result, then lifestyle management plus medications are also there. So both the things, we need to have two-pronged approach, and we need to manage parallelly: lifestyle management plus medication plus adherence for metabolic disease, and lifestyle management plus medication adherence for obesity or overweight.
Yes, doctor. And now, in your practice, doctor, how common are cases where patients have metabolic disorders alongside other chronic health conditions? And how does this influence your approach to weight management? What strategies or interventions do you employ?
Yes, absolutely. This is very common, very common. Like 8 out of 10 in our diabetes clinic, 10 patients of type 2 diabetes, 8 of them are overweight or obesity based on our Indian BMI. If BMI more than 23 in India, we consider this as overweight. Maybe more than 25 or 27, we consider this as obesity. Globally, more than 25 is overweight, more than 30 is obesity. Okay, so in this classification, 8 out of 10 definitely they are either obesity or overweight. Okay, now how to approach this? Again, like two-pronged approach. One is only for obesity care, one is for the diabetes care. Okay, for diabetes care, diabetes education plus lifestyle management, first line therapy. Over that, medications. And there are certain medications we need to take. So we usually take the history. There are certain medications which increase the weight because of the mechanism of action. That medicines is like, those medicines are like that. They have their mechanism of action, and they usually increase the weight. So we need to take care. If the patient is overweight or obesity, and he is taking in the past, if he is taking any medication which is increasing the weight, then we need to reconsider, or we need to retitrate the medications. So we need to reduce, or we can, if the metabolic parameters permits, then we can stop those medications which increase the weight. Simultaneously, there are certain medications which help in reduction of weight. So these are certain medications for diabetes which help in weight reduction. So so in this obesity or overweight type of patients with type 2 diabetes or metabolic disease, those are the perfect medications which takes care of your blood sugar level. Also, they help in your weight reduction. Okay, so we need to have this type of approach for people with obesity and metabolic diseases. Only for obesity, lifestyle management plus medications, taking care of the sugar part or ABC, HbA1c, blood pressure, cholesterol part. Only for obesity, there are certain people which who they themselves want that, please sir, you tell me whatever I want, or whatever I can do, I will do as per your advice or suggestion. But I want my weight reduction in next 3 months. I want to reduce 5 kg or 10 kg. So these are super motivated people. So I like this type of people because motivation is absolutely essential. If the person is self-motivated, then very nice. So we usually, our team, like dietitian, diabetic educator, and diabetologist, we all guide them. We have a proper session on diabetic education, 45 minutes to 1 hour session. That these are the 5 different things you need to do in next 3 months, and consistency of all this you need to do. and after 3 months we will again reevaluate your weight, your different parameters, your waist circumference. So all these parameters we will reevaluate. But consistency is absolutely essential, and individualization. You need to walk daily. Brisk walking is the king of exercise. You need to take care of your food intake like this, and consistency is essential for 3 months, and then we will reevaluate. So this is the strategy. Individualization. Most important point is individualization.
So, doctor, can you share any case or success story that has led to positive outcome?
Yes, absolutely. So, a lot of success stories. Like one, I would like to emphasize a person like 1 year before, he was 123, 123. I still remember the person, 123 kg. First time he came, family history, and we usually did basic evaluation of all the parameters. Whether he family history is there, whether he is having any other endocrinologic disease or not, any other medications which he is taking which is increasing weight or not. So after evaluation of all this, 123 kg at the baseline, and then the person every 7 days, like every 7 days, our diabetic educator and dietitian, they are in touch with them through telephonic conversation. Initially we did 1 hour session on the diabetic education part, okay, and medications are also given at that time, because he tried to reduce weight by only with lifestyle management since last 3 months, 6 months, and already fed up with all those things. Okay, now in this situation, at the baseline, we did diabetic education and given a lifestyle management plan, important dietary plan, dietary recommendation, what is to be taken, not taken. And he is from Odisha, like typical rice consuming, like based on the dietary recall, 90% of the daily intake was something related to rice, something prepared from rice. So that carbohydrate consumption reduced based on the dietary discussion. Then medications are also given at that time. So it is lifestyle management plus medications, and he adhered to the whole plan for 3 months, and then after 6 months. So after 3 months, it was 107 kg. After 6 months, recently he came to our clinic, 98 kg now. So 123 to 98 in 6 months. That is the most important success story I would like to emphasize here. More than 100 kg, any person with more than 100 kg, only with lifestyle management, frankly speaking, only with lifestyle management, it is very difficult to control the weight. Whatever said and done, it is very easy to say do lifestyle management, weight reduction will be there. But once, based on my experience with the people of obesity and weight, once your once your body weight is more than 100, very difficult to control the weight or reduce the weight only with lifestyle management. So in this situation, okay, structured lifestyle management is absolutely essential. It should be guided by any diabetologist or maybe dietitian or a diabetic educator based on the team approach. But more than 100 kg, very difficult only with lifestyle management. In that situation, if blood glucose level or if diabetes is there or hypercholesterolemia is there, then there are different medications which help in weight reduction. So lifestyle management plus medications definitely will help. And now in India, there are different medications available which are only for weight reduction. So only on an individualized basis, on a case-to-case basis, depending on the discussion with your diabetologist or the endocrinologist or your physician, people can try this only for weight reduction. Okay, so this is one of the success story, 123 to 98 in 6 months. And there are a lot of cases like 89 kg, 90 kg, 95 kg, 88 kg. So 3 months and 6 months, you usually reevaluate this. More than 10 kg, 15 kg, 17 kg, 20 kg, from 80, 90 to 65, 70. There are stories, there are a lot of success stories are there. But one thing I would like to emphasize, control your weight for our general public or audience, that control your weight. Don't wait for more than 100 and then you will try with all this treatment part. Control your weight. When your weight is within the optimum limit, maintain that through lifestyle management. But don't worry, if it is more than that, there are lifestyle management plus medications are there. But lifestyle management is key, the most important thing.
Yes, doctor. And now coming to our last question. Are there any emerging approaches or new therapies in the field of weight management for metabolic disorders that you believe hold great potential for improving patient care?
Yes, absolutely. So there are two approaches. One is like these are not new approach, I will say. These are older approach, but public awareness is not there, not optimum public awareness. Okay, so one part is the bariatric surgery. Okay, let me tell you very frankly, bariatric surgery can lead to diabetes remission. Okay, that is the surgical part. Non-surgical part, without surgery or just by lifestyle management and medications, yes, there are new approaches. For this approach, this technology is very very helpful. We need to take care of the help of technology. Okay, particularly the cgms. Every time you monitor your, like, you can know your blood glucose level, the different time in range, glycemic variability, all this. Then the smartwatch or a device which counts our movement, like our number of steps, for example. So smartwatch or step counter app, all these apps, all this technology will help definitely. So lifestyle management, which usually without technology we can do, and that can be like a rough work, but with technology we can know exactly, if we want to reduce, if we want to burn 500 calorie per day, then we need to have 15,000 steps per day. So this is the equation, this is an example. Okay, now based on this we need to take care of our lifestyle management. We need to know the exactly what is the number of steps, or what are the number of activities, or what is the duration of activities which we are doing, and what is the benefit we are getting. Okay, so if we know the numbers, if we know all these numbers, it will motivate us and it will help us. We will see the visible result in weight reduction and improvement in metabolic parameters. So the new approach, if you ask, the new approaches are like lifestyle management, the same approach, lifestyle management, but in addition or with the help of technology, to know the exact numbers before and after, and that's where motivate us and maintain the consistency related to the lifestyle management part.
Yes, doctor, these technologies are helping a lot in the management of diseases. And as we conclude this session, Dr. Surjit, I really want to thank you for sharing your invaluable insights. We truly appreciate your presence. Thank you so much.
Thank you, Dr. Harsita, and thank you, team, for organizing this type of public awareness initiatives. Absolutely essential. All these metabolic disorders, obesity, overweight, the most important thing is public awareness and lifestyle management. So we need to take care of lifestyle management, but we need to, before that, we need to know what exactly is this, and public awareness is the most important thing. Diabetes education, public awareness is the first line therapy. Okay, so thank you, Dr. Arsita and team, for organizing this, and thank you very much.
Thank you, doctor. And to our esteemed audience, we also want to express our gratitude for joining us today. Before we say goodbye, I encourage you to explore our MedSynapse platform. It offers a unique opportunity to engage in enriching discussions, connect with esteemed medical professionals, and contribute to the progress of healthcare. Until we meet again, take care, keep advancing in your medical journey. I'm your host, Dr. Harshita, signing off. Goodbye.